Expenditure on healthcare is about $6,647 per head per year in 2016, among the highest in the world. It has the highest proportion of nurses and midwives per head in Europe, 1,744 per 100,000 in 2015. Exemptions to this system include children under 16 and pregnant women, who receive free healthcare. Several other groups such as nursing women and retirees are given free healthcare regardless of the coverage they may have had in previous situations. Generally speaking, only children receive free public dental treatment. With some exceptions such as those with rare medical conditions and elderly people who live at an institution or have received home nursing care for more than 3 months also receive free treatment. But adults have to pay. In Norway, all hospitals are funded by the public as part of the national budget. Adult must pay a deductible each year before becoming eligible for an exemption card. They must pay an annual deductible called Deductible 1, about $266, and Deductible 2, about $235. Health expenditures represented 10.5% of GDP in 2016, or $6,647 per person. Salaries range in Norway is typically from $2,552.52 to $7,870.12. Average cost of living in Norway is expected to be between $2,176 to $4,352 per month. Given that everyone receives a standard deduction equal to 45% of your gross employment income up to a maximum of $12,017.76. We can conclude from these info that most of the people are able to pay the deductibles, but the ones with lower income might find it a little hard but achievable to do so. Unemployment rate in Norway reached 5.30% in August of 2020, but Norway gives an unemployment benefit amounts to 62.4% of your previous income, so it's hard to pay the deductibles, but due to the country's strict rules against unemployment, they won't stay unemployed for long. In 2016 more than 40,000 people died in Norway. Cardiovascular disease and cancer accounted for more than one-half of the deaths. 10,900 people died of cardiovascular disease. 10,814 people died of cancer. All age groups, regions, and countries are affected by the increase in the 4 non-communicable diseases: cardiovascular disease, cancer, COPD, and diabetes. Low and middle income countries are the most affected. Cardiovascular disease. Each year, approximately 40,000 individuals are treated by the Specialist Health Service for heart attack and angina, 16,000 for heart failure and 11,000 for stroke. Around 1.1 million Norwegians were treated with drugs to prevent or treat cardiovascular disease. In groups with low educational attainment, a higher proportion have heart attacks than in groups with high educational attainment. Cancer. Lung cancer is largely attributable to smoking and is the form of cancer with the highest mortality. Over 32,000 new cases of cancer were diagnosed in Norway in 2016. Diabetes. About 245,000 Norwegians have diabetes. Mental disorder. In any year, about 1 in 5 adults, 16-22%, will be affected by a mental disorder. Together with other Scandinavian countries, Norway has the highest level of hip fractures in the world among women. From cost of in-hospital care according to diagnosis table, cardiovascular disease has highest cost and highest number of hospitals. Each health region has a university hospital fully equipped and prepared to provide for the health needs, and there is at least one hospital in each county. Only 4 of them have more than 800 beds, and no hospital can be found with a size between 601 and 800 beds. Somatic hospitals are small, with less than 100 beds, where the provided services are only in general internal medicine. In 2019, the highest number of hospital beds in Norway was in the health region Southeast Norway with 7,957 beds. There are 3 levels of hospitals: local, central and regional hospitals.